China, authorities have begun lockdown as authorities rush to curb COVID-19 outbreak and avoid the spread that devastated Shanghai. Guangzhou reported 3,007 local infections on Wednesday, accounting for over one-third of new cases across China.
China's southern metropolis of Guangzhou has locked down more than 5 million residents as authorities rush to stamp out a widened COVID outbreak and avoid activating the kind of citywide lockdown that devastated Shanghai earlier this year. The city reported 3,007 local infections on Wednesday, accounting for over one-third of new cases across China, which is experiencing a 6-month high in infections nationwide. Guangzhou became the epicenter of China's latest COVID outbreak, logging more than 1,000 new cases, a relatively high figure by the country's zero-COVID standards. The ongoing outbreak is the worst since the start of the pandemic to have hit Guangzhou. The city is the capital of Guangdong province, which is a major economic powerhouse for China and a global manufacturing hub. Most cases in Guangzhou have been centered in Haiji district, a mostly residential urban district of 1.8 million people on the southern bank of the Pearl River. 2 more districts with a combined population of 3.8 million were locked down on Wednesday as the outbreak widened. Residents in Liwen, an old district in the west of the city, woke to an order to stay at home unless absolutely necessary. College and universities in the district were told to lock down their campuses. Restaurant dining was banned and businesses ordered to shut, apart from those providing essential supplies. Starting from Thursday, all primary and middle schools in the city's 8 urban districts are moving class online, with kindergartens closed. Tutoring classes, training institutions, and daycare centers will also suspend services, the city's education officials told a news conference on Wednesday. Mass testing has been rolled out in 9 districts across the city, and more than 40 subway stations have been closed. Residents deemed close contacts of infected persons, which in China can range from neighbors to those living in the same building or even residential compound, have been transferred en masse to centralized quarantine facilities.